Ferrari at breakfast.
With the British Airways American Express Accelerating Business Card, check out the world.
LBC. This is LBC with Ian Dale. Call 0345 6060 973.
9:23 on LBC. Dr. Jane Townson is Chief Executive of the UK Homecare Association. Very good evening, Jane.
Good evening, Ian.
I must apologise for keeping you waiting for so long, but I think you were listening to my conversation with Ed Davey and will probably understand why I wanted to talk to him for so long. Now, as Chief Executive of the UK Homecare Association, how do you view today's events?
Well, Ian, it's been billed as fixing social care, but it's really nothing of the sort. You mentioned earlier that the health and care levy, increasing national insurance contributions, will raise 36 billion over 3 years. Of that 36 billion, 30.6 billion will go to the NHS and only 5.6 billion to social care over 3 years. And that's just nowhere near enough. Our workforce is right now on the brink of collapse. We've got the most severe shortages of home care workers that anyone can remember in history. I was out filming with a TV crew last week, and every single care worker, every single care manager they spoke to dissolved in tears. So what Ed was saying about exhaustion and gender issues, I really agree with. And however much money they throw at the NHS to appease voters, it's not going to help them to have no social care there. Already, hospitals are full and they're unable to discharge people home and into community services because there isn't the capacity. And furthermore, if we neglect older and disabled people in the community, wait until they've reached a point of crisis, then transport them into an acute hospital, which is the most expensive setting, where quite often, unfortunately, people deteriorate and lose function so that they need even more long-term care, but then we can't get them out again. How does it actually help? How is this helping us all to live well at home and flourish in our communities?
Let me go through the figures again, because you rather shocked me there when you said that over 3 years of the 36 billion, only 5.7 is going to social care. Because
I think it's 5.4, actually, 5.4 billion. And of that, 2.5 billion is for the so-called DILNOT proposals. So they've talked about a cap of £86,000 on care costs, but only 1 in 7 people end up with care costs more than 100,000. So that isn't really going to help all that much. And then, the rest of it, 2.5 billion over 3 years, it's not even going to scratch the surface, because we've got a workforce of 1.6 million. That's more people than the NHS. And many of them are on the national minimum wage, which is a disgrace. It's shocking. We need to be able to reward the care workers fairly for the skill and experience that they bring to these roles, because it's not just making a cup of tea anymore. People only receive state-funded home care when they've got quite significant healthcare needs. So it's complex, multiple conditions, end-of-life care, dementia care, stoma care. Often during COVID-19, home care workers were expected to perform tasks that normally district nurses would do, or even in some cases general practitioners. So the goodwill of our care workforce is stretched beyond any reasonable limit at the moment, and it's just really unfair.
Is the hope that once the NHS backlog has been dealt with, which you would expect to have happened, you would hope would happen within 3 years, that then after that, that's when the full amount can actually be devoted to social care? Is that what the government have been saying? Because there does seem to be a bit of a mixed message here, in that it's being all talked about social care, but from what you're saying, most of the money isn't going to social care at all.
No, it isn't. And, we've got general demographic pressures. So right now, there are about 1.6 million people over 85. By the time I get to 85 in 30 years' time, there are going to be 3.5 million people over 85, so more than double the numbers that we've got now. So if we can't cope now, what is it going to be like in 30 years' time? So, there's been a lot of conversation about national insurance being unfair, and I understand partly where that's coming from, but everyone needs to understand, first of all, that now 50% of the budget is spent on people under 65. But also, this is a long game. I mean, none of us know at any time when we might have health and care needs. And we all need to prepare for the future, for ourselves and for future generations, because what we've got now isn't working. We're not coping.
How much money do you think would be needed if you, in your analysis of the social care system, how much extra money would be needed per year to make it work in the way that you would hope it should?
I think commentators like the Health Foundation, for example, have done various scenarios, estimates that go up to about 14 billion extra. I think it all depends what you're trying to do. I mean, Age UK estimates that 1.5 million people currently need support and care but aren't receiving it. You heard from Ed about how many people there are providing informal care with virtually no support, 9-10 million. Maybe during COVID that went up to 13.5 million. Many of those people are absolutely on their knees. They're desperate. And we've also got the issue of the workforce and paying them fairly too. Before this announcement, the government invested only 4% in home care of what it invests in the NHS. We would argue that we'll never shift the needle unless we start investing in community and social care, getting that help to people to enable them to live well at home, preventing them from deteriorating. And some of these conditions, I mean, dehydration is a major reason for people ending up in hospital. They get dehydrated, which leads to urinary tract infections, which leads to falls. Then they end up in hospital and lose function and then need even more care when they came out. Well, why don't we just help people to drink more in the beginning? It's not rocket science, but some of that low-level support, helping people with shopping, cooking, all of that's been stripped away. And we're just leaving everything till it gets to a crisis point and then putting everybody in acute hospitals or care homes.
OK, Jane, thank you very much. That's Dr. Jane Townson, Chief Executive of the UK Homecare Association.